when you've been told you're getting old or you're too old since you were 19, it starts to lose any power. And like now I'm 47 and it's like, you can't tell me I'm too old for anything.
I'm Dr. Sheila Farhang, and welcome to Derm Approved, your insider access to skin that looks and feels its best. Today on Derm Approved, I have the one and only Holly Madison. So from being in the public eye in the peak mid-early 2000s, beauty standard and beauty culture, which is like very iconic, to navigating beauty, aesthetics, self-image just over the years. I feel like this is going to be such a good conversation for us to kind of delve into what beauty means to you now. The aesthetic space, things have changed so much, but I feel like people are just so nostalgic about the early 2000s.
Yeah.
So I'm so excited to kind of delve into that, as well as the more recent things that you're doing. So thanks for being on the show.
Of course. Thanks for having me.
Of course. Okay, we're going to start with something fun. So in the world of like AI, you never know what's real or anything, but I did some digging and I want to know if this photo is real.
Yeah, that is me, my senior year in high school. And I don't know what you would call me alt maybe, but I was very experimental with my look. I'm an Aquarius rising. I always wanted to look different. So I was always doing all kinds of things, whether it was like coloring my hair or doing like punk jewelry or just making things.
Almost like a character.
Yeah.
Yeah.
It was fun.
This, I looked at it and I was like, was she goth? Were you goth?
I don't know. I mean, like a hardcore goth person wouldn't call that goth. I would say just more you'd call it alt, I think.
Got it. Yeah. So then from kind of this moment, what started that kind of love for beauty in that sense?
I'd always kind of loved it in theory. Ever since I was really young, I always loved women like Anna Nicole Smith. I was obsessed with like Marilyn Monroe and the old movie stars. And I always thought the women of Playboy were the prettiest in the 90s, like Jenny McCarthy and Pam Anderson. You'd always see like Playboy commercials on TV late at night, or you'd be in like a Suncoast video store. That's so 90s. And they'd have like the Playboy videos, and just the women on the cover looked so pretty because they were always lit so well and their makeup was perfect and just nobody looked like that. But I didn't really get into it for myself until like right after high school. And I wasn't really doing it in college. It's more like I just wanted to look like that. And halfway through college, I transferred universities. I moved to Southern California. I started working at Hooters. So that's when I started to like put it into practice a little bit more.
Got it. And it was really just the feminizing look. I mean, it was definitely a look. So it's interesting because we talked about our mutual, one of my patients and clients. She was on your podcast as well.
Yeah.
Sarah Underwood, who I know you guys. Yeah, she's so great. So I don't know if it was her or someone else, but they said that right when you kind of got in the house, it was like people automatically went to like Garth Fisher, and it was like boobs and noses. And everyone, what was that like? And who was the one who made that decision? It was like, was it that one girl saw the other girl and was like, I want that? Or was it or was who was kind of like recommending plastic surgery?
I mean, it's kind of a different journey for everybody, and it's kind of different. Like I started coming to the Playboy parties and then I ended up dating Hef. So that's kind of different from coming into it from just being like scouted as a centerfold and coming into shoot. And, you know, obviously a woman isn't chosen to be a centerfold unless she's beautiful or fits that standard or whatever. I did hear a story, and this was like way after the fact, and it kind of shocked me to hear about. One of the Playmates came on my podcast and said that the editor at Playboy at the time told her that, you know, we could buy you a nose job and then you could come back and test. And if you make it, you make it. And if you don't, we'll pay for your nose job. And that, like, my jaw was kind of on the floor. Like, I feel like I don't know how ethical that is. Like, I guess it's different if somebody really wants to be a Playmate and they're just begging, like, what can I do different? And maybe you'd want to tell them, I don't know. But I feel like that's kind of a weird thing to do. But as far as I know, that was not commonplace. It's like, I started working at the studio and directing the Playmate pictorials for 2 years. And like when girls would come in, I had a dentist that they could go get their teeth bleached, or maybe we would dye their hair one color or something, like get rid of highlights or something like that if it wasn't photographing well. But I would have never presumed to like suggest plastic surgery.
Yeah.
I think some of the playmates came in and, shot their pictorials and then maybe a year or so later started thinking, oh, maybe I want like a fuller chest. And that was totally, their decision. And, of course, they would ask around. They'd want to know who the best of the best was. And there would kind of be go-to people amongst like the mansion crowd. Not that you had to go to that person, but everybody wanted to know, word of mouth. And back then, like Garth Fisher was the one for boobs. That's who I went to. I went to Raj Kanodia for my nose. He's amazing.
Yeah. Still in practice. I think still in practice too. For Fisher. Yeah. So that's really interesting. But yeah, it just seemed like also in that era and compared to like what I do, which I'm a cosmetic surgeon, but I focus a lot on like non-surgical derm procedures for people. Even boobs, I do like more non-surgical if we need to do some Sculptra in the boob and just get a little bit of like oomph or tighten the outside of the skin. Kind of a non-surgical breast lift, very like subtly. It's so different than back then where plastic surgery was just so big. Like even with lips, I feel like people did fat transfers and Lisa Rinna, talked about silicone. So it's very plastic surgery heavy. Like, did you notice that? Or was there a lot of like non-surgical approaches to aesthetics too?
I don't think there were a lot of non-surgical things like there are now. And I remember when I was in my 20s, in the early 2000s, I don't think people were getting like silicone in their lips. I think it was a similar type of injectables that they use now. But the technique
For sure.
is completely different. Like I felt like when women, like no offense, but I felt like when women in the 2000s, like everybody wanted to look like Angelina Jolie. Like all of a sudden big lips were in. And I felt like it never looked natural and it always looked like the duck lip. And of course things changed over the years. And in the early 2010s, people started doing them so that they would, expand kind of this way and not out like a duck pout. But I felt like, I don't know if lip injections were a good idea in the early 2000s.
Yeah.
I personally, I guess everybody's taste is different, but I personally didn't think it was the look.
Yeah. No, I agree. And like you said, even in the 10 years that I've been practicing, I've kind of always done a similar thing, but technique has refined a bit as far as the fillers that are out there, a little bit more flexible, a little less thick.
Yeah.
Yeah. So, and I feel like more people know to use them, although there's still like that look with some places that you
Sometimes
go.
it happens, yeah.
Sometimes but I feel like it's not like it's expected. Like if you're gonna go somewhere really great, reputable derm plastics, you're gonna get great lips versus before there wasn't as much knowledge there. But of course, if you go to an area or a place that isn't as advanced, you could end up with some of those issues that I'm always dissolving lip filler like in my office and starting from zero.
Wow.
And sometimes people will get lip filler and they didn't know, but it's non-dissolvable. And that's like where the issue happens.
Oh,
because there's like filler that's dissolvable and then filler that's non-dissolvable. So
that's hard.
I know. What was the competition like as far as beauty, like in the house while you were there?
I mean, for Playmates, like things would get kind of competitive around Playmate of the Year, but I don't know if anybody thought they could do anything about the way they looked at that point, because you've already shot your pictorial and you're kind of expected to maintain that same look and like not dye your hair for 2 years while you're doing promo for it and whatnot. So I don't know if the Playmates were competitive with each other looks wise. As far as like the girlfriends.
Yeah.
And I'm talking about before Girls Next Door. I don't think we cared, the three of us during Girls Next Door.
Yeah.
But before, I think when there were 7 girlfriends, kind of everybody was like hoping to be chosen for some kind of like feature in the magazine. So everybody wanted to have big boobs and to get a nose job, which I did both of those. And it kind of just turned into a domino effect where not everybody, but a lot of people were getting those. But I don't know, like I can't really answer that, how much of that is coming from competition and feeling like the need to keep up or feeling like you might get chosen for pictorial or something versus just, okay, I'm here and I want to get as much opportunity out of it since I'm putting the time in. So if she's getting this, maybe I want that too. Like, I don't know if it was a competition thing. It might have just been like, let's make sure I'm getting as much out of this as I can. Or maybe it was just something they wanted the whole time. I don't really know.
What was like the big goal for people? Was it that they wanted to be like Playmate of the Year, or they wanted to be one of the girls, they wanted to live inside the house? Like what was like the ultimate goal?
I mean, it was probably different for everybody.
yeah.
I think most of them wanted to be in the magazine in some capacity. There's a period of time when I was living there where it was just me and one other girl, and there were so many other girls going out with us, and they all kind of wanted to fill like those empty 5 spots, and he kind of kept it that way for as long as he could to see how long he could keep all these people coming out without having to like pay for anything or have anybody live in the house. But eventually it like the 7 spots got filled. So, I mean, I'm assuming like everybody wanted to be in the magazine. I think people just wanted to, you know, get money or gifts or maybe make contacts up there that would help them in their career. I'm sure it was kind of different for everybody. I don't know if there was like one big goal everybody was fighting over. If I had to pick one thing, it would probably be like to be in a pictorial or something.
Oh, okay. I know you mentioned on another podcast, actually, there was like a lady there. I think you kind of like you were like, she's almost like the Giselle.
The recruiter.
Yes,
there was always a recruiter in the group when I was there. Not when it was me, Bridget, and Kendra, because we weren't like recruiting other people. We were like, let's just keep it us 3. But before then, there was always somebody in the group that would like try and like drag people into the group. And I just felt like that. I mean, I didn't like it personally, but I just feel like it's rather unethical. And I think a lot of predatory men rely on a woman to do that because a woman's presence is so much more reassuring to other women. And, you know, and then they don't have to like do that part of the dirty work themselves.
Yeah. And you saw that firsthand, which is insane. I'm sure it happens in so many other kind of industries within that industry too, which is crazy because she was supposed to be with you guys, you know, like your advocate in a way. Was there a certain look that recruiter was looking for?
I mean, everybody knew Hef liked blondes, and it was a very cookie cutter look, like blonde, skinny, big boobs. But sometimes she was just looking for like quantity. Like she was looking to like bring people in who wouldn't necessarily end up a girlfriend. So maybe she didn't have to be blonde. It was just kind of like
just like you said,
greedy.
Kind of like starry-eyed, like just moved to LA, wants that life type of thing. You mentioned that you had the boob job and the nose job. Was that your idea or was that his?
No, it was definitely my idea. Yeah.
Because other girls would, I know you said that you were getting it and then kind of like that became the fuel for the other girls maybe getting it, maybe because you were like his number one girl at the time.
Yeah, I mean, I knew there had been girls who lived there before me who he'd bought surgery for. So I just asked. And then after that, it was like kind of domino effect with the other ones who like came after me.
Yeah.
But I don't know if they were getting it because of me. They just might have seen it as like what I saw with people before, like, oh, this is what's possible.
Yes. And it's so funny to think of those two things. So the boobs, the nose, the blonde hair, and then also the figure. Run me through how diet culture was back then and how you guys all stayed thin.
I think it was different for everybody. Everybody was really young. So I think a lot of people could eat whatever they want and not worry about it. That was just their body type. And they were in their early 20s, so they didn't have to worry about it. For me, I had body dysmorphia and I wanted to stay really thin. So I would count every calorie that went into my mouth. I had every food I could possibly eat just memorized in my head. There was no app or anything. Like we didn't have smartphones back then. Like I memorized every calorie. So I knew exactly what I was putting in my mouth, which is not necessarily healthy. I think I was over fixated on that.
Yeah.
And there are times I look back, not the whole time I was there, but there are times I look back and think, oh, I was a little too thin for my taste.
Yeah.
Like, where did my ass go? but there were other people, like, obviously I don't want to like out anybody specific, but there were definitely eating disorders.
For sure.
So it was all over the place. It was like serious eating disorders to like mild eating disorders to just people who really didn't have to worry about it.
Yeah. And it's almost like, especially with people with some type of, not eating disorder, but like kind of like the restricted, it's almost like this control you have. Because maybe you didn't have control over other things. I don't know. It's just a really interesting thing because I know what you're talking about with the calorie counting. And that's like very, very kind of a specific, like you do like 1,200 calories. You know exactly what you're having. And then you were at the house. So it was probably like very consistent every day.
Yeah, absolutely.
Yeah.
And I knew whatever restaurant we went out to, I knew what I was going to order and how many calories it would have.
Yeah. How did the body dysmorphia change as you left the house? Did it stay with you or...
Not entirely. I definitely wasn't worried about staying as thin because I wasn't living under this roof where I felt like I had the pressure to be perfect at all times. Because he would definitely make comments if I was like bloated or whatever. But I still feel like my sense of what I really look like is a little off to the point where I still weigh myself almost every morning because I feel like to keep my health on track, I kind of need to know what the number is. And I don't necessarily recommend that for everybody. Like it's not necessarily the healthiest thing to weigh yourself, but
yeah, but it's kind of like
I do.
Exactly. It's hard to completely stop like old habits. 1000%.
Yeah.
What was like getting ready like? Was there like, what were the skincare products you guys were using back then? Did you share them? Was there a whole routine or not really like back in the house?
I don't know what anybody else used. I'm trying to think. I mean, I've been using Retin-A since I was 11, so that's always been part of my routine.
Yeah.
I'm trying to think, what did I use for skincare back then? Oh, you know what else I would use is the self-tanner gel, the Clarins that used to work so well.
Oh, yeah.
I went to a dermatologist and she was like, Anna Nicole Smith used this. So I was like, I have to use it too. But I loved it. It used to work so well.
Yeah.
I mean, I would always wear like a sunscreen moisturizer during the day. But it honestly like was not anything fancy. Like it wasn't the fancy like
and
SkinCeuticals type products that we had now. It was nothing like that. But one thing I started using probably toward the end of my time there, because I would always, like I had acne when I was young. That's why I went on the Retin-A.
Yeah.
And I would have like small breakouts after. And I always loved like I don't even think they make it anymore. I buy like a dupe version on Amazon, but they used to have the tea tree oil foaming face wash from Body Shop. Like that's so good for acne prone skin. I loved it. And it like really gets your makeup out too. And it's a good brush cleaner.
Yes. No, it is. Tea tree oil is an astringent and it helps with acne. And I think if your skin's not super irritated and dry, and I would say if maybe you're living in Vegas, it would be a little dry, but I feel like it's way more humid here.
Yeah.
But I know exactly, it's like in a green, is it like in a green bottle?
Clear tube. Yeah.
I know exactly what you're talking about. But I feel like it's not as, skincare was not as big back then. People don't have their like cult favorites, no 10-step skincare routine. That's probably also why your skin looks really good as the Retin-A.
Yeah, thanks.
I know. I feel like the people, it's like if you know, you know, like if you had acne, it's almost like a good thing that you had it because they put you on such a strict, derms put you on such a strict, and I had acne as a teen as well. So I knew about the sunscreen that you have to use because you're using the Retin-A and they're really like, we're really, really strict about that. And then
that's probably what got me on sunscreen. Now that I think about it.
1000%. And they were probably like, you can't be out in the sun and show your, you know, all of that. So it's probably just like ingrained from your derm when you had acne. And that's probably why you look so good.
Thanks, Mom, for taking me to the dermatologist.
Yes. Do you have any like regrets of the early 2000s?
Plucking my eyebrows way too thin.
Yes.
Like anytime a photo pops up in the early 2000s with like the plucked out, bleached out eyebrows, I just cringe. I hate it so much. But I was also like experimenting with my look so much. And I had those Kevin Aucoin books. I don't know if I'm saying his last name right, but you know, where he would like make people look like old movie stars. And like, so I was into trying all that kind of makeup out, and I experimented a lot and it didn't always look good.
Yeah,
but it was fun, and that's how you learn.
Yeah.
My patients often come to me asking what they can do at home to treat fine lines and wrinkles, and I'd love to recommend Medik8 Liquid Peptides Advanced MP Serum. It's clinically proven to diminish the appearance of expression lines in 10 minutes and deep set wrinkles in 8 weeks. Medik8's Liquid Peptides Advanced MP Face Serum is powered by the GF mini protein, which mimics the function of natural growth factors but penetrates deep into the skin to visibly improve the appearance of skin structure over time. Combined with the expression line mini protein, Medik8's Liquid Peptides Advanced MP Face Serum is clinically proven to diminish the appearance of expression lines in just 10 minutes and deep set wrinkles in just 8 weeks. I mean, peptides are huge right now, and patients come to me asking about them all the time. And when I'm looking and vetting a product, I'm always looking at what that peptide can actually do and if it's actually working. Is it penetrating through the skin? Is it doing what it needs to do? With a lot of these newer ingredients, this is the one thing that I tell my patients to look out for, and Medik8 definitely does that. So as I guide them through what to look for a product, is they need to be derm recommended, and there needs to be some type of science or clinical backing, because peptides are great, growth factors are great, but we need to make sure that it's actually doing what it claims. So actually going through and penetrating the skin and doing what it needs to do. Medik8 is a clinically proven British skincare brand known for visible age-defying results. All Medicaid products undergo clinical testing, which I love as a dermatologist, and have amazing before and afters, derm recommended. Discover Medicaid Liquid Peptides Advanced MP Serum online at medicaid.us. That's MEDIK and the number 8.us. Use code DERMAPPROVED for 20% off your order. So as a dermatologist, skin cancer surgeries are a big part of my practice. I mean, I live in the desert. I also have a practice in Beverly Hills. So those are very sunny states. So it's hard to find a sunscreen. You know, patients are asking me all the time. And although I tell them a certain number SPF to look out for, like SPF 50 and above is a great number to start with. And that is like, will check all of the boxes for me. It's so hard to find a sunscreen that actually feels good on your skin, that doesn't just feel sticky or white, that doesn't blend in, that's oily. Like I'm sure we've all found those sunscreens that are like clogging our pores, that have a white cast, that feel sticky. So nowadays, I feel like there's so many more brands that are coming out with more elegant formulations that are a little bit more hydrating, that blend in really well, that don't feel sticky, but still give us the protection that we need. And honestly, Ulta if you haven't heard of them, you've been living under a rock, because they are people's favorite. They really are. I've been working with them for years. If you didn't already know, Ulta is not only the #1 dermatologist recommended and trusted professional sunscreen brand, but dermatologists use Ulta personally more than any other sunscreen, and I can definitely vouch for that. Ulta sunscreens are formulated with ingredients to help protect and correct UV damage across skin types and skin concerns. Another big question that I get from my patients is, do I need to wear sunscreen in the winter? Do I need to use it on a rainy day when it's cloudy? And the answer is yes. You also need to use it really indoors also, especially if you have windows, because that UVA that's going through the windows will contribute to aging, but also some skin cancer too. So I always say that 365 days a year is a must for SPF. If you struggle with dry or dehydrated skin, you need to try Ulta UV Daily Hydration Plus SPF 50. It's available untinted and tinted. Visit www.ultamd.com to shop and learn more.
Are there any big like plastic surgery regrets that you or anyone that you know back then, like they would all do, and then now you girls are talking and you're like, I can't believe we did that?
You know, I think with breast implants, it's such a tricky thing because some people, it just doesn't work for whatever reason.
Oh, yeah.
Their body will reject the implant, or they'll get the breast implant illness, or the surgery will be kind of botched, so they want to try again. And it's sadly can turn into this never ending thing. So I think that's an important thing to look at if you're wanting to do that. I have had a really great experience with my surgery, but I mean, that one's a tricky one, definitely.
Yeah.
I don't have any other regrets. I can talk about a more recent thing that I think was a waste of money is I wanted to do hand rejuvenation.
Oh, yeah.
So I did the whole laser filler combo, and then your hand kind of swells up the first day and looks like a hospital glove with ice in it. And then it goes down, and I had the cutest chubby hands. And I was so excited, but that was just the swelling, and it went away in a week. And it was like I blew all this money on nothing.
That I know that's true, because you compare it to like how great it looks in the beginning, and all biostimulants.
No, girl, it didn't make any difference. I'm not just comparing to the beginning. These hands are as bony as the day I walked in. If you took it before, it was a complete waste of money.
I wonder if it was hyperdilute radius. What was it?
I don't remember.
Yeah, it was an injectable. Sometimes the only thing to do is just fat transfer into the hand, but it's like
that
a
works
whole
better
thing.
than filler.
Yeah, but that's like a whole thing, you know.
Well, if I put on some weight, maybe I'll
maybe. Yeah, exactly. What are some of your favorite kind of non-surgical treatments to get?
Definitely Botox.
Yeah.
That's a regular one.
For sure.
IPL laser, like I said. I've tried other things like microneedling and stuff. I don't necessarily see a difference. It's just kind of like on good faith that this is good for you over the years. I'll do one every once in a while. I did a CO2 laser under my eyes over Christmas break, and I felt like that helped a lot. Not that I don't have wrinkles under my eyes still, but I felt like it took down like the static wrinkling. I felt like it really helped. And the guy who did that was like people usually get this like once a year. So I might continue doing that.
Yes. I
Even
love
though
a good
you're
CO2.
really swollen for like 2 days
So
after, like your eyes
swollen.
are like swollen shut
I know.
almost.
Did they put the shields in your eyes to go over your eyes?
But I was surprised when I woke up the next morning because
Yeah.
it was New Year's Eve and me and my kids were like staying at the Fontainebleau so we
Yeah.
could have like the firework view.
Yeah.
And I woke up the next morning and I could only fit a contact lens into one eye because they were like so swollen.
Oh my God. I know. I feel like people need a heads up on CO2 because people want that in my office all the time. And I do a lot of CO2, but it's like, if you want really good results, we have to go enough to do it like once a year or like, because, several things are like multiple times. You do it like 3 times back to back, 1 time a month, and then you're good. The CO2 truly is one of those things where it's like 1 time and then you're good for like at least a year or a few years. But yeah, there's some downtime with it for sure. Yeah. Neck. Any good neck stuff that you love?
I tried. You know what? I started I think I was about 30 when I started to notice. I wish I could go back in time and treat my neck exactly like I'm treating my face. So if you're out there and you're like a teenager or 20 or any age really, whatever you do to your face, also do to your neck. If you shade your face in the sun, your neck. If you use a product at night, your neck as well. Product at day, your neck as well.
Yeah.
But I feel like I've started to see return on that from just picking up that habit maybe like 10, 15 years ago now.
Yeah, same. And I feel like we always forget because it's our neck. We think it's covered by our head. And what's crazy about the neck is it's so much thinner than the skin on our face. So it actually ages more. So when we do want to do like something like a CO2 or a skin tightening treatment, we have to go way less on the energy. And you need multiple treatments just to catch up to like the treatment you're going to get on your face. So that's even more of a reason to treat or protect your neck. So we kind of talked about this a little bit before. So early 2000s, like I said, the boobs, the nose, people are still getting those type of surgeries, but I guess a little more subtle in a way. But one thing that has definitely boomed, especially in my world where I do a lot of the non-surgical, or people are really kind of jumping into facelifts. What are your thoughts on that?
Well, I love it. I've had a lower facelift on my jawline.
Yeah, you look amazing.
Thank you.
Yeah,
I'm really happy I got it done.
Yeah. How long ago?
Like a year.
That's
already?
it. Okay.
Yeah.
Loves just the lower. I love, and then the scars like in the back or in the front.
It's like in the front of my earlobe. Like I kind of like put makeup over it.
Yeah.
And my earrings. If you look close, you can totally see it, but I don't even care.
I love
I'm open about it. Like I already talked about it on my podcast. So I'm like, I don't even care if somebody sees the scar.
No,
like, who cares?
I love it. What was the recovery like?
Fun because I stayed at the Beverly Hills Hotel and had a nurse.
I love that hotel.
So, oh my God. And it was so fun. Okay. When you drive up on the right, there's like a parking garage and they would drop me off there because it's secret
so it's
entrance.
not in the front.
Yes, I'm not walking down that red
valet
carpet
and the
entry.
red,
Yeah,
the red.
embarrassing.
Yeah.
But I noticed on the lower level, there's the most amazing classic car collection you will ever see. In fact, this reminds me, like, I want to go back and see if this guy will like let me film him and like make a video because I'm so fascinated by this and I never see anybody talk about it. They have like this huge variety of like classic cars, new cars. Like, I guess I don't want to say who, but like a famous movie star like keeps one of his cars there. And there's this guy who works there who like maintains all the cars. And it's the coolest little thing.
Interesting. Because I do feel like sometimes they'll bring it out and I'll see one in the front, when you're driving up to the valet. But I didn't know that they like kind of like keep them there.
It's so cool. Yeah, I was chatting with that guy with a bandage around my head.
I'm sure that was not the first time they saw it and not the last time they saw it over there. So was the recovery as easy or as hard? Like, what was it compared to like what you thought? Like, were there any friends that had it first and then you were like, I'm gonna get it?
No, it was pretty easy.
Yeah.
I mean, I was pretty swollen. I don't even remember. I kind of like put it out of my head after it happened. I don't remember like what the time frame was. So I'm probably not going to give you an accurate gauge. But like, I think I took like 2 weeks off from filming my podcast. And then I came back. I was still a little swollen, but I would like make sure my hair was more like this a little bit. But it was fine. And I think especially since like I didn't want to tell anybody I was getting it right before I went in because I'm superstitious. And like if I'm recovering, I don't want to let anybody know I'm compromised in case they want to do any witchcraft or anything crazy on me. But it's just my weird superstitions. But after I was done, I told everybody on my podcast, so I didn't feel like I had to hide anything. And it was just easy and fun.
Yeah, it looks really great. And I think it's because you didn't do the full with the brow
I
lift.
don't have any desire for that yet. So why?
Yeah.
Like, I don't want to Spock brows for no reason.
Yeah, it does. It looks really natural.
Thank you.
What did you tell your plastics? What did you want to address? Like a little bit of jowling, and then did it fix that?
Yeah, and a little bit of lipo under my chin. I just felt like after having kids, I gained a lot of weight with my second pregnancy, and there was just nothing I could do. There was no lasers or anything that could really do what I wanted it to do. So I did some research online and found somebody whose before and afters I really loved, and just met with her a couple times and told her, I didn't want it to go too far. This is what I'm looking for. Like, I'm always very conservative in my approach when I go in for a surgery. I feel I'd rather have it not go far enough, and then I can go back and maybe do more rather than have it go too far and I'm looking like the Joker.
Yes. So you're so right. So and I think that's why you honestly look so good, is because you have your doctors scale back a bit. And I've had people, kind of both type of patients, come into my office where they're like, I want to really get in there and I want it to be noticeable. And there's people that obviously more my style, which is like, we can always add more. We can always do more. It's so much harder to scale back after you've gotten
too much,
especially when you're cutting, especially when you're doing surgery. Of course, non-surgical is a lot easier. So you got it basically in your mid 40s, which I feel like, again, if thin skin, gaining weight, pregnancy, losing the weight, you have laxity there. And truly, when you have laxity here and you've tried all the different things, sometimes a facelift is the only thing that can take care of that. And so you're happy with it.
Yeah, I love it.
You look amazing.
Thank you.
Sometimes people get fat transfers like into the cheek and stuff like that. Did you ever get that? Like where they take a little bit of fat and then like inject it?
No, I have lost a lot of volume right here. So I'm always putting concealer right here, trying to like disguise it.
Yeah.
That's another thing that annoys me when people are online saying, oh, this person's had buccal fat removal. I'm like, I think she just aged.
Yeah, 1000%. Like if it was... Yeah, like who's the Euphoria gal?
They say it about Alexa Demi.
Yes. And she always had those dimples. I think she just lost so much weight. And she was thin, but then when you get a little older and you lose weight, you really do lose it in your face.
Yeah, Alexa Demi is not messing with her face.
Yeah.
They would if they were her.
Exactly. Yeah. But I can see, and it's like the type of makeup that was also done. It's a very different type of makeup that she had before. So I totally agree with that too. I think if it's very obvious from like without weight fluctuations, then yes, you could say it's a little buccal fat pad removal. But I think it's just like aging.
Yeah,
aging process.
Totally.
Sometimes a little sculpture down here will help. Like I will usually, when I do filler on patients, I'll go like back in here because there's this ligament right here and everything ages in front of that ligament. And so I kind of go back in here and do like a little sculpture, just filler, because it really does pull.
Oh,
I mean, it's not like
interesting.
facelift results, but it just will add a tiny bit. And then I'll go like into the hairline.
Yeah.
And that will help pull without having volume put into the face.
What do you think about filler in the temple? Because I'm really hollowed out here. But then my injector was like, yeah, you can go blind if you do that. So I was like, never mind.
Yeah. That's not like the highest risk area for blindness. The nose is. And I do both. Yeah, the nose is like really, because there's actually like an artery that goes here and into there. The temple is a high risk area, but I go in with what's called a cannula. So I just make a little entry point and then fan in something that's blunt. Like it's a blunt tip. It's not a needle. So it basically will just go around. I'm not going inside the vessel. I like to do the tiniest bit. Sometimes we don't want to. A little bit's good because it also pulls the lateral eyebrow. So I could always do that for you. It's always, and it's like very little bit. It's like some people go in like one full syringe on each side. The old technique is just to go all the way down deep onto the bone. And that's where it gets really risky. And that's where I could go into the glands. But just a little bit, like superficially here, will give that really. So basically I go in and then I do it in the temple, but then I also like fan it into the hairline to get a little bit of that lift. But you don't want to do too much because you don't want it to become
Spock eye.
Yeah, like Spock eyed or super heavy. And then your cheek will kind of blend away. So that's why I'm really careful about temple filler, but a little bit actually helps kind of like lift things up. So
cool.
So I'm always a fan. But yeah, I feel like you said, mid 40s, that's like not too early to get a facelift because especially thin skin in that area, you're like so face forward and what you do, people are starting to get it and think about it in their late 30s, early 40s. And that's where I'm like, it really just depends. Like instead of going by age, because I'll be 40 next year. And although I've thought about it and I was like, oh, that would just be so easy to.
What?
Yeah, I
you
know.
Don't need
no,
that.
I
What
know.
are you
I'm
talking
just like literally in the industry. No, there's so
I
many
think it's
other
just
things.
like we're all sitting in front of our magnifying mirrors,
know.
kind of seeing stuff
Yes.
nobody else sees.
Exactly. But I will say on the other end, like you had a great experience. You went, I'm sure it's the best surgeon here in town, but I've seen a lot of botched jobs with facelifts that people, the younger you are and the tighter skin you have back here, that skin is like pulling. So I've seen some really bad scars back there on younger people who their surgeon said was a good candidate and they did it and they really didn't. So I would say that for people watching, some people obviously have really good results, but don't take a facelift like lightly, that decision, because it is a surgery and you can get some really bad scarring and then you can't put your hair in a ponytail because your scars are really obvious.
Yeah.
So as we're wrapping things up, question for you. What do you want aging to look like for you in the next 20 years?
You know, my first thought, I think a couple of years ago would be like, I just want to look exactly like this. I want to be perfectly preserved. But I'm just kind of interested now to see how it goes because I think I like the way I look better as I get older. Like you couldn't trade me back to like 25-year-old me. You know, I like how I look better now. And I'm just kind of interested to see how it goes and how like my personality continues to develop and how that meshes with my look. I think 90% I still want to preserve and look exactly like this. But like 10% I'm like, we'll see.
Will you get another face? I mean, facelift lasts about like what, 10, 15 years? I've seen some last longer, but would you get another one?
Some people say that people go in every 5 years. Is that crazy?
That's when they're like so subtle. I would say that's not a long time. I would say 10 years if you got a good facelift, but also the younger you get it, I think the more often you have to get it.
Oh, really?
I think so.
Okay.
Yeah, because you kind of have like aging spurts, which sucks. But they said 44 is one and 60 is the other one.
Okay.
So, and then of course, like if you're like postmenopausal, all the collagen is like, we see it and accelerated. So I think that, I mean, everyone is so different. Like you could have it really depends on the type of facelift you got. Deep plane facelift, like the smaz, you know, there's so many different type of facelifts too. Some people just pull up the skin, which I don't recommend that one. That one is like old school. That's where you look really, really fake is when they just pull the skin without pulling the deeper structures. And usually, you know, people are doing that if it's like a in and out without general anesthesia and they'll just do like a day thing. They do that a lot in Tucson and the scars end up not looking great and they're not preserved. Like I feel like that's like a 5-year facelift basically when that's just the skin getting pulled up. But yeah, I think so. You're not afraid of aging basically.
Not anymore. And you know, when I first came to LA and I was 19 and going on auditions, like old men, not even the old man you're thinking of, but just old man in the industry or in town would be like, oh, you're 19. Well, you better hurry up and make it. You're getting old. And it's like when you've been told you're getting old or you're too old since you were 19, it starts to lose any power. And like now I'm 47 and it's like, you can't tell me I'm too old for anything.
Yeah.
Because it's like it loses all its power. Because people were telling me that at 19. Who cares?
Yeah, and it's not true at all. I think we can embrace the aging process while still do something about it, like not letting ourselves go. And I think that's the big thing that I do for my patients is like making them feel confident, making them know that it's not too late after a baby, after divorce, after menopause, after a sickness, after taking care of their mom for years, you know, things like that. And it's like never too late to kind of take care of yourself.
Yeah, I think so too.
Well, thank you so much.
Thanks for having me. This is fun.
So much fun.